Good morning. Excellent. I'm welcome to the 2023 HCPLAN Summit. I'm Dr. Alice Chen, co-chair of the Executive Forum and Chief Health Officer at Centene. I know we are really excited to be welcoming you to the first summit since 2019. Clearly, we need a little practice in terms of getting here on time, getting into the ballroom, all good. We have an anticipated 500 people scheduled to be here in person and another 800 virtually. So this is a really, really exciting reconvening. I will say, when I was reflecting on this, given spiraling healthcare costs and worsening population health, our mission, our collective mission, to accelerate payment reform and value-based care is more important than ever. We know that cross-sector collaboration and engagement is essential to achieving our collective goals of better health outcomes, health equity, and affordability. So it is really wonderful to see so many people kind of making the time, carving out their day to be here together. They say a picture is worth 1,000 words, and so I'm going to save us some time. We're going to share a 5-minute video that summarizes LAN's work over the past year and gives you a sense of our future focus. I do hope you share our sense of positive momentum, even as we know how far we yet have to go. And as you watch that, if you're not already involved in one component of what HCPLAN is doing, this is your chance. So again, thank you for being here, for being part of the movement to advance APMs and accountable care. All right, so there's another saying, an organization is only as good as its people. LAN's work would not be possible without thought leadership, strategic direction, and the committed action of the members of our executive forum and 3 strategic initiatives. So I want to take a moment to recognize our new members. If you're here, give a wave. I know some people are on here virtually, some people have conflicts. So since the last summit, LAN Executive Forum has welcomed 4 new members: Adela Flores Brennan, just looking for ways, Director of the Colorado Department of Medicaid; Mike Levine, Director of Mass Health, Massachusetts. You can do shout outs if you want. Hold the applause, but you can do shout outs. Massachusetts Medicaid Program. Dr. Angelo Sinopoli, co-chair of Physician Focused Payment Model Technical Advisory Committee, and Dr. Kate Goodrich, CMO at Humana. Moving on, the LAN's Health Equity Advisory Committee team, or HEAT, welcomes Social Current, led by President and CEO Dr. Jody Levinson Johnson. All right, we're still warming up here. And our ACAC, Accountable Care Action Collaborative, welcomed 3 new organizations: Accountable for Health, led by Mara McDermott, the CEO, Mara McDermott. American Physician Groups, APG, led by President and CEO Susan Denser, who I believe is having a concomitant conference here today. And United States of Care, led by CEO Natalie Davis. Please join me in welcoming our new LAN Executive Forum and Strategic Initiative members. All right. So I'm going to provide, and for those of you sitting in the back, I know this is we're in person for the first time, seeing hugs, reunions, but there are seats up here. Feel free to come on down and have a seat. I want to give you a brief overview of our speakers and sessions today. We have an outstanding, thought-provoking lineup of speakers that includes leaders from CMS and state government, as well as national and local representatives from community-based organizations, payers, health systems, and leading researchers. We are delighted to start the day off with CMS Principal Deputy Administrator and Chief Operating Officer John Blum. He'll be followed by Duke University's Margolis Center for Health Policy Director and my LAN Executive Forum co-chair, Dr. Mark McClellan, who will set the stage for today's panels. We then have a set of 3 panels in the morning and 3 panels in the afternoon. Our first morning panel features key CMS leaders. You should know them well. Dr. Meena Shishmani, Director for Medicare; Dan Tsai, Director for Medicaid and CHIP Services; Liz Fowler, Director of CMMI; and Dr. Dora Hughes, Acting Director of the Center for Clinical Standards and Quality. That will be followed by a panel on advancing accountable care through multi-payer and multi-stakeholder alignment. The third panel of the morning highlights many of the issues that we're grappling with in terms of how to collaboratively I need to, 1 minute warning. Okay, I'm gonna talk very quickly. How do we actually collaborate with CBOs to advance health equity? That's something many of us are grappling with. And then this afternoon's trio of panels are equally rich, starting with a panel featuring partnerships between payers and providers to test and evaluate innovative strategies to improve patient care. Moving on to a panel that highlights what you heard about LAN's Person Perspectives Council, which is our new initiative to integrate individual patients and caregiver perspectives into our work. And then we'll finish the day with the panel sharing the results of our 2022 APM measurement survey. I want to give a shout out because this annual survey on APM adoption has really become a benchmark for our industry, and it'll be exciting to hear the details of our progress. Last but not least, I want to call out 2 opportunities who are available for those of us here in person. I apologize to our virtual colleagues, but this is an incentive for you next year to come be with us in person. The first half of the lunch hour will be a panel of health plan representatives with CMMI Deputy Director Ara Tabe Bedward discussing operational considerations and challenges for payers to implementing value-based and accountable care models. And then the second half will be with CMMI's Deputy Administrator Ellen Lukens and Chief Strategy Officer Purva Rawal discussing CMMI's key priorities regarding accountable care for complex populations. So 2 really important kind of real-world issues for us to grapple with. It'll be in-person, interactive, so grab your lunches, meet us back here for those exclusive sessions. Before we get started, I have a couple housekeeping messages, if you want to pop up the slide. I've given you a high overview of what to expect for the day. All of it will be here, we'll be together. I think there's a slide that shows the guide book app. So if you want specifics in terms of details of the panel, speaker bios, resources that people are going to be referencing, download the guidebook app on your phone. If you are at home, all of the same information is on our website. Lastly, we are all about continuous improvement. Please, I know things are busy, but take a moment to let us know what works well, what doesn't work, what you want changed, and what you want to see for next year, both after each session and after the summit. So now, having gone over my time, it's my distinct pleasure to introduce our first session, CMS Leadership Point of View, presented by John Blum, CMS Principal Deputy Administrator and Chief Operating Officer, to share remarks on the agency's progress on accountable care and how the LAN can contribute to this progress. Please join me in welcoming him.